Warm welcome to all of you. We are here today to discuss about certain cognitive disorders. I will start off with dementia in particular and then go ahead with certain other disorders once we talk in detail about dementia. Dementia is a syndrome where there is a deterioration in cognitive functions like memory, thinking, and based upon which there is a difference in the behavior and the ability also to perform everyday activities deteriorates. The word dementia is derived from a Latin word meaning madness, where the root is de, which means without, and ment means mind. It's a serious loss of global cognitive ability in a previously unimpaired person beyond what might be expected of normal aging processes. Although it's very common in elderly individuals, dementia is not a normal part of aging process. Many people live up to their 90s and even 100s without any symptoms of dementia. It's one of the major causes of disability and dependency among older population across the world. Worldwide, 35.6 million people have dementia and there are about 7.7 million new cases which are being diagnosed every year. Out of this, Alzheimer's disease is supposed to be the most common cause of dementia, which contributes to about 60 to 70% of cases. Dementia is a word used for a syndrome which is usually chronic or progressive in nature. Dementia affects memory, thinking, orientation, comprehension, calculation, learning capacity, language, judgment. The impairment of cognitive function is commonly accompanied and occasionally preceded also by deterioration in emotional control, social behavior or motivation too. Dementia is caused by a variety of diseases or injuries which primarily or secondarily affect the brain, such as Alzheimer's disease as I told you earlier, or stroke. It may be in a static form which is a result of a unique global brain injury, or it can be progressive resulting in long-term decline due to damage or disease in the body. Although it's far more common in geriatric population as mentioned earlier, about 5% of those over 65 are said to be involved, and it can occur before the age of 65 too, in which case we call it early onset dementia. Normally, the symptoms must be present for at least 6 months in order to be diagnosed as dementia. Let us now talk about the prevalence of dementia. Worldwide, 35.6 million people are supposed to be suffering, with just about over half, that is 58% living in low and middle income countries. Every year, 7.7 million cases are diagnosed. The estimated proportion of the general population with ages 60 and above with dementia at any given point in time is between 2 to 8 per 100 people. The total number of people with dementia is projected to almost double every 20 years to 65.7 million in 2030 and 115.4 million in 2050. Look at the rapid increase which is estimated. Much of this increase is attributable to the rising numbers of people with dementia who are living in low and middle income countries. Let us briefly look at the types of dementia, the disorders related to dementia. These classifications or schemes attempt to group disorders that have particular features in common, such as whether they are progressive or what parts of the brain are affected. Let's start off with cortical dementia, for example. Dementia where the brain damage primarily affects the brain's cortex or outer layer is called cortical dementia. It tends to cause problems with the cognitive functions like memory, language, thinking, and of course social behavior. And subcortical dementia, on the other hand, is that which affects the parts of the brain below the cortex. And this subcortical dementia tends to cause changes in emotions and movement in addition to the problems of the memory that we have been talking about. There is what is called this progressive dementia, which gets worse over time as the name indicates, gradually interfering more and more with cognitive abilities. Primary dementia is a dementia like AD in the sense Alzheimer's disease that does not result from any other disease. Secondary dementia can be dementia which occurs as a result of physical disease or injury. And the status of the person as this picture shows, is in a confused, unclear, lost, perplexed, disoriented and bewildered condition in most of these dementia cases. Now let us look at the forms of dementia. As you see in this picture, Alzheimer's disease is the most common form of dementia, which may contribute to about 60 to 70% of the cases. Other major forms of dementia are like vascular dementia, dementia with Lewy bodies, with abnormal aggregates, which involves abnormal aggregates of protein which develop inside the nerve cells, and a group of diseases which contribute to frontotemporal dementia, which is a degeneration of the frontal lobe of the brain. The boundaries between different forms of dementia which we have been talking about are indistinct, and sometimes mixed forms may also coexist. Dementia can be classified either as irreversible or irreversible. It depends upon the etiology of the disease, and fewer than 10% of the cases of dementia are due to causes which can be reversed with treatment. Let us now go into the details of these different forms of dementia. First and foremost, as we have discussed earlier, is the most common form of dementia, which is Alzheimer's disease. It is seen in people aged usually 65 and older. In Alzheimer's disease, which we are going to discuss in detail in the next lesson, Alzheimer's disease is characterized by two abnormalities basically. One is amyloid plaques and neurofibrillary tangles, as the picture over here shows. Now, the second most common form of dementia is vascular dementia. This accounts for about 20% of all dementias and is caused by brain damage from cerebrovascular or cardiovascular problems, usually like strokes. The third form that we are going to discuss now is Lewy body dementia, which is once again a type of progressive dementia, which is a common type of progressive dementia. This usually occurs sporadically in people with no known family history of disease. Another form of dementia is called frontotemporal dementia, sometimes also called frontal lobe dementia, and this describes a group of diseases characterized by degeneration of nerve cells, especially those in the frontal and temporal lobes of the brain. The lobes are seen in the picture. Another form of dementia is HIV-associated dementia, which results from infection, as the name indicates, with the human immunodeficiency virus which causes AIDS. Huntington's disease is another form which results from genetically programmed degeneration of neurons in certain areas of the brain. This degeneration causes uncontrolled movements, loss of intellectual faculties and emotional disturbance as well. Dementia pugilistica, also called chronic traumatic encephalopathy or Boxer's syndrome, as the name indicates, is caused by head trauma such as those experienced by people who have been punched a number of times in the head during boxing bouts. The most common symptoms of the condition are dementia and Parkinsonism in this Boxer's syndrome, which can appear many years later after the trauma ends. Another form is cortico-basal degeneration, which is a progressive disorder characterized by loss of nerve cells and atrophy of multiple areas of the brain, and brain cells from people with this disorder have abnormal accumulations of the protein called tau. Then there is what is called Creutzfeldt-Jakob disease. It is a rare degenerative fatal brain disorder which affects about 1 in every million people per year worldwide, and most cases of this CJD appear sporadically, that is in people who have no known risk factors for the disease. Let us now talk about the symptoms of dementia. Dementia affects each person in a different way. It depends upon the impact of the disease and also the person's personality before becoming ill. The signs and symptoms linked to dementia can be understood in 3 different phases. Let's start off with the early stage. The early stage of dementia is often overlooked because the onset is gradual, it's progressive. Common symptoms during this early stage include forgetfulness, losing track of time, getting lost in familiar places. Then comes the middle phase or middle stage. As this dementia progresses to the middle stage, the signs and symptoms become clearer and more restricting to the individual. Some of these symptoms are becoming more forgetful of the recent events and also people's names, getting lost even at home, having increasing difficulty with communication, needing help with personal care, experiencing behavior changes, including wandering and repeated questioning about the same thing. Then comes the later stage. The late stage of dementia is one of near total dependence and inactivity. Here memory disturbances are serious and the physical signs and symptoms become more and more prominent and obvious. Some of these symptoms can be becoming unaware of time, place, having difficulty recognizing relatives, friends, having an increased need for assisted self-care, having difficulty in walking basic functions, experiencing behavior changes which may escalate and also include aggression. What could be the causes of dementia? Well, there may be many. All forms of dementia result from death of nerve cells and or loss of communication among these cells. Many types of dementia, including Alzheimer's disease and Lewy body dementia or Parkinson's dementia or Pick's disease, are all characterized by abnormal structures called inclusions in the brain. Because these inclusions, which contain abnormal proteins, are so common in people with dementia, researchers suspect that they play a role in the development of symptoms, and genes play a clear role in the development of some kinds of dementia. However, in Alzheimer's disease and certain other disorders as well, the dementia usually cannot be attributed to a single abnormal gene. Instead, these forms of dementia appear to result from a complex interaction of genes, lifestyle factors and other environmental influences as well. And dementia is not merely a problem of memory, though it is termed as the problem of memory. It has more aspects to it. It reduces the ability to learn, it reduces the ability to reason, retain or recall the past experience, and there is also loss of patterns of thoughts, feelings, activities. Additional mental and behavioral problems, in addition to whatever we have been talking, often affect people who have this dementia, and they may influence not only their life but also the quality of life of their caregivers, and also it may call for the need for institutionalization of the individual who is undergoing dementia. As this dementia worsens, individuals may neglect themselves and they may become disinhibited and they may become incontinent too. Behavior may become disorganized, restless, inappropriate. And when people with dementia are put in circumstances which are beyond their abilities, there may be a sudden change to tears or anger, this is called as catastrophic reaction. A common symptom of dementia sufferers is to deny that even people in their immediate family are their own relatives. And one of the effects can be depression. It affects about 20 to 30% of people who have dementia, and about 20% of people are supposed to have anxiety. Psychosis, often with delusions of persecution and agitation or aggression, also often accompany dementia. But each of these, please remember, must be assessed and treated independently of the underlying dementia. So when people come with problems like depression or anxiety, especially among those with other symptoms as well, then dementia has to be carefully assessed if they have dementia. How is dementia diagnosed? We are talking about the assessment of dementia. How is it diagnosed? Well, a number of strategies are there which are employed to diagnose dementia. It's important to rule out any treatable other conditions, like for example depression or vitamin B12 deficiency, which may cause similar symptoms as well. Now, early accurate diagnosis of dementia is very important for patients as well as their families, because it allows early treatment of symptoms too. Basically, patient history is taken. Doctors often begin with patient history, examination of the patient suspected of having dementia by asking certain questions related to the history of the patient. They may also try to evaluate the emotional state of the patient, although patients with dementia often may be unaware of or in denial about their disease which is affecting them. There is also a physical examination which is necessary, which can help us rule out the other treatable causes of dementia and identify also signs of other disorders which can contribute to dementia. This will also help us in helps the doctor in identifying signs of other illnesses like heart disease or kidney disease or failure, which may overlap with dementia sometimes. There are neurological evaluations which are necessary, where the doctors will perform a neurological examination looking at the balance, the sensory function, the reflexes and other functions to identify signs of conditions. For example, movement disorders or stroke can be identified, which may affect the patient's diagnosis and can be treatable with drugs. Then in addition, we have cognitive and neuropsychological tests which may be used, which measure memory, language skills, then mathematical skills and other abilities related to the mental functioning of the individual, in order to help them, the assessors, diagnose the patient's condition more accurately. In the present days advanced technology, brain scans have become very important. They are used to identify strokes, tumors or other problems which can cause dementia. Also, it identifies what is called cortical atrophy, which is a degeneration of the brain's cortex, the outer layer of the brain, which is common in many forms of dementia and may be visible in this brain scan which is taken. These brain scans can also identify changes in the brain structure and function, which may suggest something like Alzheimer's disease. The most common types of brain scans are CT, computed tomographic scan, and magnetic resonance imaging, which is called MRI popularly, and electroencephalograms, the EEGs, are also used in people with suspected dementia. Many patients with moderately to severe Alzheimer's disease show abnormal EEGs. EEG can also help diagnose CJD. Functional brain scans, on the other hand, include functional MRI, fMRI it is called, single photon emission computed tomography, which is called SPECT, positron emission tomography, which is called PET, and magnetoencephalography, which is called MEG. Laboratory tests are also done based upon the need, of course, to help diagnose dementia or to rule out or to rule out the other conditions like kidney failure, which we have discussed earlier, which may contribute to such symptoms. Such tests may be a complete blood count, blood glucose test, urine analysis, drug and alcohol test, toxicology screen. It is called cerebrospinal fluid analysis to rule out any specific infections which can affect the brain, and analysis of thyroid and thyroid stimulating hormone. And there will be a psychiatric evaluation too. A psychiatric evaluation may be obtained so as to determine if depression or any other psychiatric disorder may be causing or contributing to the symptoms of the person. Then pre-symptomatic testing is also done in disorders like Huntington's, where a known gene defect is clearly linked to the risk of the disease. A genetic test can be helpful to identify people who are likely to develop this kind of disease. What could be the treatment? We have talked about several forms of dementia. We have understood how to assess the symptoms and all. Now, how do we treat? There is no one particular treatment which is currently available to cure dementia or to alter its progressive course. However, a lot is there to offer in terms of support and to improve the lives of the people with dementia as well as their caregivers and families. Basically, the principal goals of dementia care would be basically early diagnosis and optimizing the physical health of the individual and the cognition, activity and the well-being of the individual. Identifying and treating the accompanying physical illness if any, detecting and treating behavioral and psychological symptoms, and providing information and long-term support to the caregivers of the person. Many people in the early stages may benefit from practicing tasks designed to improve performance in specific aspects of cognitive functioning. For example, people can be taught to use certain memory aids, which you know are called mnemonics. Behavior modification like rewarding appropriate or positive behavior and ignoring inappropriate behavior also may help control unacceptable and dangerous behavioral patterns. Now, coming to the prevention aspect of it, many prevention measures have been proposed. These include lifestyle changes and medication, although none has actually reliably been shown to be effective. Research has revealed a number of factors which may be able to prevent or delay the onset of dementia. For example, studies have shown that people who maintain tight control over their glucose levels tend to score better on tests of cognitive function than those with poorly controlled diabetes. Several studies have also suggested that people who engage in intellectually stimulating activities like social interactions, chess, crossword puzzles, and playing musical instruments significantly lower their risk of developing diseases like Alzheimer's disease and also other forms of dementia. Scientists believe mental activities may stimulate the brain in a way that increases the person's cognitive reserve, that is, the ability to cope with or compensate for the pathological changes which are associated with dementia. Researchers are also studying various other steps that people can take that may help prevent disorders like Alzheimer's disease in some cases, though none of these factors so far have been definitely proven to be to make a difference in the risk of developing the disease. Especially in the cases where certain forms of dementia that we have discussed a little earlier today in the session, when there is a genetic condition which may be determining the form of dementia, in such cases a proactive nature in the family and the caregivers and the necessary tests once there are certain symptoms which we have already discussed about, identification of these symptoms and early diagnosis, and then taking care of these symptoms and having the treatment started early may go a long way. In genetically predetermined diseases, definitely when there is a predisposition, necessary care right from the beginning, from an early stage, would really help the patients. And caretaker distress is one particular feature which is being much researched about today. Hence, psychological interventions which are targeted towards improving the quality of life of the patient as well as the caregivers, and then measures to alleviate or minimize the distress of the caregivers would really help not only the patient but also the family in dealing with the disease. The disease, as we said, may not be cured, but it can be managed. And for the caregivers in this particular case, especially in the case of dementia, several forms of dementia, the distress and depression which may be there in the caregivers can well be managed if they are given necessary education, provided necessary awareness, and also told how to manage the situation, what could be the steps in being able to handle the patients.